Hey, good morning. I'm Dr. Bill Fleming. I am currently the Texas Medical Association president, and today I'm speaking on behalf of TEXPAC, which is the political arm of the association. I want to welcome everyone to the TMA. We are a 156-year-old organization dedicated to improving the health of all Texans. We approach that call to action in many different ways. We sponsor vaccination clinics for children, organize medical emergency responses to disasters such as Hurricane Katrina and Hurricane Ike. We help our physician members run their offices more efficiently and effectively so that they have more time and resources available to care for their patients. We advocate in the Texas legislature and Congress for laws that improve the public health and protect our patients. In fact, one of the American Medical Association principles of medical ethics states, a physician shall respect the law and also recognize the responsibility to seek changes in those requirements which are contrary to the best interest of the patients. For physicians to follow that ethical obligation successfully, we must work hard to elect leaders who share our vision and who will work with us to improve the health of all Texans. That is the purpose of TEXPAC. And by the way, I'm standing in for Dr. Susan Strake this morning, who is the chairman of TEXPAC, who couldn't be here. TEXPAC speaks on behalf of 44,000 Texas physicians and medical students and 8,000 alliance members. Organized in 1962, TEXPAC is one of the oldest political action committees in Texas and one of the largest bipartisan PACs in the state. Recently, the TEXPAC Board of Directors met to begin making our endorsements for the 2010 primary elections. We made quite a few decisions, which you will be hearing about from us and our endorsed candidates in the coming weeks. Obviously, the board spent much of its time discussing the office that has the most impact on public policy in Texas. The conclusion we reached was obvious. Governor Rick Perry has been a sound leader on patient care issues, and TEXPAC is proud to endorse him for re-election in 2010. The TEXPAC board endorsed Governor Perry because of his unwavering support of defense of Texas's medical liability reforms and his efforts to protect the sacred patient-physician bond. We appreciate his guidance to ensure prompt payment by health insurance companies and his strong support to provide physicians with meaningful and real opportunities to serve in rural and underserved areas. We thank Dr. Perry for his leadership and look forward to continue working with him shoulder to shoulder to improve the health of all Texans. We're excited about working with him through the 2010 election and the 82nd Texas Legislature. I'm honored to introduce you to a gentleman who has committed his adult life to creating a more prosperous and healthy Texas. With a physician as his father-in-law and a nurse as his wife, he knows firsthand the challenges of patient care in Texas. Throughout his distinguished public service career as a member of the Texas House of Representatives and as a Commissioner of Agriculture and as Lieutenant Governor of Texas, and for the past 9 years as governor, he has worked closely with physicians and listened to our concerns on behalf of our profession and our patients. Please join me in welcoming a principled leader, a genuine conservative, and the 47th governor of our state, Governor Rick Perry.
Thank you, Dr. Fleming. Thank you very much. And your leadership of this incredible group of committed caregivers is obvious, and it's an honor to be here today with the good people of the Texas Medical Association. It's a very humbling experience for me to gain your endorsement of my candidacy.